Across the country, high rates of suicide, unemployment, and homelessness among veterans attest to the economic hardships they are encountering. The very people that fought, risked our lives for the sake of our country, have to suffer not just physical and economic scars, but mental scars as well. PTSD, post traumatic stress disorder, affects many of our veterans today. But what is PTSD? PTSD is a disorder that occurs after someone experiences a traumatic event that threatened or involved serious injury or possible death. There are some characteristic symptoms of PTSD on the right from the article Post Traumatic Stress Disorder by Jonathan I. Bisson. Due to some of the symptoms of PTSD overlapping with the symptoms of other disorders, here are 7 symptoms that are unique to PTSD. These symptoms consist of intrusive memories of traumatic event, dissociative flashbacks, nightmares, avoidance of external reminders, avoidance of thoughts or feelings associated with traumatic event, hypervigilance, and exaggerated startle response. On the right is a chart of overlapping symptoms between PTSD and depression. Common traumatic events that lead to PTSD consist of war, sexual assault, abuse, natural disasters, and surgeries. There are some factors associated with PTSD on the right. This is how the events that happen in Kindred connect to PTSD factors. Instances of physical abuse in Kindred consist of whippings, slapping, and cutting off body parts. Instances of verbal abuse in Kindred consist of yelling, threats, and manipulation. And finally, instances of sexual abuse in Kindred consist of rape, degradation, and disrespecting consent. PTSD in Kindred is demonstrated through symbolism caused by the experiences that the characters went through during the time of slavery. PTSD is still prevalent in the present due to other traumas, such as war and assault, that people experience today. Here's how Butler explores the issue of PTSD in Kindred. Despite Butler not directly referring to PTSD, she connects it metaphorically through her writing. Here we will take events in Kindred and connect it to what it symbolizes. The first event is Dana's back being scarred after she got whipped in the fields. This symbolizes the trauma that people go through that leaves scars psychologically. The second event is Kevin having an extreme reaction to what was playing on the television, connecting it to him witnessing abuse. This event symbolized some of the PTSD symptoms that many survivors go through. Going more in depth on Kevin's reaction to the TV scene. Here it says on page 191, there was a public service announcement on advising women to see their doctors and take care of themselves while they were pregnant. Just to note that the announcement was only mentioning the topic of pregnancy. Kevin proceeds to tell Dana to turn it off, which is actually in avoidance of an external reminder, which is why he's turning off the TV to not think about his traumatic event that he saw. Kevin says, I saw a woman die in childbirth once. This woman's master strung her up by the wrists and beat her until the baby came out of her, dropped onto the ground. Kevin is clearly describing an intrusive memory he thought of the traumatic event that he went through. Analyzing all of the quotes at hand, we can clearly see that Kevin is experiencing multiple symptoms of PTSD. These symptoms are not minor and will most likely affect him for his entire life. This is very similar to how our soldiers feel, as they can be triggered by things that may seem minor to the public eye. Butler conveys her understanding of past trauma affecting the present in a few ways. The first way is making her characters go through traumatic events literally in the past. Second is seeing how those events affect how the characters act when they go back to the present. And the third way is using physical scars to symbolize mental scars for those who went through trauma. Two big questions that Butler wants us to think about are, how does the past impact the present? And what can you gain from having critical distance of traumatic events? PTSD is shaped by many consequences of the past, such as slavery and war. These events in the past have left a serious scar on those who were involved, affecting them for life, including my own family. PTSD used to be treated way differently in the past compared to today. They use a combination of rest, tranquilizers, electroshock therapy, hypnosis, and dismissal. These practices were not effective since they were not attacking the root of the problem. They were only attempting to disassociate the person from their own trauma. In the book, Assessment and Treatment Planning for PTSD, Frey writes that patient preference coupled with provider knowledge regarding the severity and complexity of the case should guide the initiation of a particular treatment course for a patient with PTSD. This quote should be taken greatly into account due to the fact that many people who suffer from PTSD have different severities and require different forms of treatment. Today, PTSD is commonly treated by therapy, antidepressant drugs, gradual exposure to trauma, and cognitive behavioral therapy. By analyzing what practices ease symptoms and what wasn't effective, we can then apply to treatment in the present day to help us better understand PTSD. PTSD intersects with me because my grandfather fought in the Vietnam War, and I know he is extremely affected by the recurring symptoms of PTSD. Now knowing more information about how to support people with PTSD, I can understand what my grandfather needs to thrive. So hopefully you also apply what you learned about PTSD to support veterans that you know too. Here is my works cited page, and thank you very much.